Okay. So good afternoon. Sorry for the little delay there. We're just having a few technical issues, but hopefully we're all sorted now. Thank you for joining this ARC-GM seminar. For those of you who don't know me, I'm Penny Lewis. I'm the Academic Career Development Lead. Today's talk actually comes from my own theme, capacity building, and it's going to focus on an evaluation of our internship and pre-doctoral programme. There's going to be plenty of time at the end for questions. I thought it would be a good opportunity to share a little bit about what we've done in capacity building overall and what we've achieved to start off with as a bit of an introduction. If you have questions as we go along, pop them in the chat, and we'll come to them all at the end like I've. So this is the team. I'm sure you're all aware of many of us, but it just really highlights that we're growing. We've taken on more programs, and so we have a specific focus in areas now like social care and knowledge mobilisation. So we've become a much bigger team. Also like to highlight what we set out to do from the start. So this is in the our capacity building strategy. So our aim was really to build capacity and capability to do excellent research. So upskilling healthcare practitioners and professionals across Greater Manchester health and care organisations to understand research, but also ultimately to do their own research and lead on research in some cases. And then also to be able to use research that exists already. So we work across, obviously, the University of Manchester, but we also work closely with other higher education institutions such as Salford University and Manchester Met. And we have connections across all of Greater Manchester health and social care kind of organisations. And we work closely with our PCIE theme as well. Our activity covers lots of different programmes. Some of these are more established than others. So we have an internship programme, our pre-doctoral fellowship programme, our PhD students and postdoctoral fellows. But more recently, we have our social care research champions, and now actually that's grown into interns as well, and pre-docs, and our knowledge mobilisation programme as well. Today, we're really going to focus on an evaluation of interns and pre-doctoral fellowship. I'm just going to do a recap. I know many of you have been involved in supporting and supervising some of our interns and our pre-doctoral fellows, but just as a little bit of a recap, it would be useful to sort of explain who we have and what kind of activities they undertake. So our programmes for our internship and pre-doc fellowships are for those who are employed in health and social care organisations across Greater Manchester, but they exclude dentists and doctors. So we're really looking at those that are traditionally kind of underrepresented in health and care research. And we've had a huge variety of practitioners and managers from across different roles in Greater Manchester health and care organisations. So that's been great to see. Our internship programme is for those who want to dip their toe into research. They perhaps have very limited experience or none at all, but they're interested to know a little bit more. And they're for up to 12 months, and they take 30 days experience to be used flexibly across that time to have some experience working alongside an internship supervisor. They don't have backfill funding. They do get a pot of money that they can use for their own training, depending on their needs. And we do a learning needs assessment when they start to identify what they might want to use that resource for. And some of them might take a master's level module. However, the time commitment for them is quite large. So often they might do much smaller courses. And we offer a core kind of set of training modules that cover the basics in terms of developing a research question, exploring the literature, patient and public involvement and engagement, research inclusion, just to give them a flavour of all the kind of core components that they might need within research or need to be aware of. and their internship supervisor is allocated when they get their award. Our pre-doctoral fellowship program, as it kind of demonstrates in the title, is suitable for those who perhaps want to go on to do a PhD. They've typically got some research experience, so they know that what they're kind of reaching and aspiring for. It's between 12 and 18 months, and they do get backfill, and they typically work up to half a week on their developing their pre-doctoral idea. They get a little bit more money to spend, and a lot of them will undertake one of the master's level modules to upskill them in a particular area of need. They do have access to the core training as well if that's relevant and that's something they want to do. And typically we expect them to have a supervisor in place already. However, we will support them to find somebody suitable if that's not the case. So far, since the start of the ARC, we've actually provided 69 people have gone through our system, our programmes, and they have been from across 16 organisations, so a huge kind of reach in terms of engagement from different organisations. We've had 47 internships, 29 pre-doc fellowships from across 18 different types of professional groups. And some people have actually taken on the internship and then gone on through to pick up, to undertake a pre-doctoral fellowship. And this picture here, this is from our capacity building brochure, which we've shared before. We might share a link again for those of you who perhaps not seen it. And again, it just shows there the kind of the geographical spread of our interns and pre-docs that we've supported. We know that 3 are now on a PhD programme, which is wonderful. And then we've got 2 others that are just awaiting their interview for either the NIHR or the Forward North PhD scheme. Just wanted to highlight a newer programme that we've taken, that we've rolled out now, is our capacity building and social care programme. So NIHR are keen really to build up research and capacity in social care. So this is focused funding for recruiting social care research champions to kind of raise awareness of research, to find those people who have got potential and interest in being engaged in research. So we've currently got 2 social care research champions, and we've just recruited some more, as well as an intern, so that's great to see. And with this programme of work, we've really sort of working closely with Dr. Caroline Lear, who is a senior lecturer in mental health over at MMU, and across local partner organisations who are involved in social care. Also highlight our DEMCOM programme, and this is all about building capacity in dementia research. They are funded by the NIHR and the Alzheimer's Society, and we've got 4 dementia research fellows currently in post. And we've recently also taken on some research assistant interns as well. Another recent development, again, NIHR understanding the time that needs to go into developing a competitive application for one of their career development schemes. So we're talking about our the PCAF, the pre-doctoral fellowships, or the doctoral clinical academic fellowships, or even the advanced fellowships. And this part of funding is there to provide individuals who want to apply for these programs time, so backfill, to work up their applications, work with supervisors to do that, to undertake any training that's necessary, and do some PPIE, so they have a pot of money to undertake that patient and public involvement work. We currently, and we met with them this morning, we've got 7 candidates from across 3 NHS trusts and 1 university. And we will be having another round where we actually seek for nominations for people who are suitable for these awards to start in the coming months, and that will go out shortly, so look out for that. If you know of anybody that you think would be suitable for this, then please get in touch, and we'll be happy to answer any questions. Also, just to highlight other programmes, so we had a health economics internship programme with 4 health economics students, which was led within the health economics theme itself. One of those went on to apply successfully for a pre-doctoral fellowship. We had 2 public involvement internships as well, which was led by our mental health theme. We've supported 16 PhD students, and some of these have been successful in going on to research posts and lectureships. 2 members of our ARC operational team have gone on to pursue a PhD, and we've had various promotions from research associate to fellow, as well as one of our our PhD students themselves being promoted to this. So I'm going to stop there, but as you can see, lots of activity, lots going on across from our team and from everybody else within our building work, which is great to see. I'm not going to ask for any questions now relating that, but happy to answer any at the end or pop them in the chat. I'm going to hand over to Rebecca Elvey, who's going to talk about the evaluation that we've been doing on our internship and pre-doctoral programs themselves. So we just see if we can share the slides. There we go. Hopefully everyone can see that. So I'm going to put myself on mute.
Thanks, Penny. Hi, everyone. I'm back. I think I know most of you here. So Penny's outlined the kind of breadth of ways in which ARC-GM supports people and organisations to build research capacity. And she mentioned the internship and pre-doctoral training programme, and I'm going to now focus on our evaluation of this. Can I have the next slide? So just to give a really quick bit of background, so over the last 2 decades or so, there's been recognition that compared with medicine, other healthcare professionals were behind in terms of research capacity and what was termed clinical academic career pathways, that is, careers combining clinical and academic work. And so this was documented in reports and recommendations were made, and various programmes are now well established, run by NIHR and other funders. You might have noticed the outdated language I've used already there, but at first the focus was on nursing and midwifery, then on allied health professionals as well, and now social care is included. And the terminology's moved on. So we are now talking about health and social care professionals and practitioners and clinical and practitioner academic careers. So ARC-GM is obviously one of 15 ARCs around England, and there are various research capacity building fellowships and schemes running in other ARCs. The ARC-GM one started in 2020 and has evolved over time, and it's now open to any graduate in the GM health and social care system. Next slide, please. So we carried out a process evaluation of the intern and pre-doc training programme because we wanted to understand what works well, how and why, and what the challenges are. We found the work of Jo Cook really useful in shaping our evaluation. So I'm just going to refer to Cook's definition of research capacity building here. So she says that research capacity building can be seen as a process, so a means to an end, with that end being useful research that informs practice and leads to health gains. But research capacity building can also actually be the end in itself in terms of developments in skills and structures that enable research. And Cook developed a framework for capacity building with 6 constructs which operate at 4 levels, and we've applied this to our analysis. Next slide, please. So we carried out a qualitative process evaluation. So in terms of our sample, we invited all past and present trainees from the intern and pre-doc programme. So these people based in the health and social care organisations in Greater Manchester. We also invited managers based within those organisations and past and present supervisors who are based in ARC, GM and or the University of Manchester. So the samples summarised here. In the terms of the professions represented, so there's people from a range of roles and in a range of settings across acute, community and mental health trusts. they were quite diverse, and they were also diverse in terms of their research experience. So some people came into the programme with no research training or experience. In terms of supervisors, they ranged from people working at grade 7 in research or academic posts up to professorial level, and the managers were a mixture of line managers, of trainees who undertook the programme, and a couple of people who held strategic roles in trusts focused on supporting clinical and practitioner academic careers. So it was a qualitative process evaluation. So we undertook thematic analysis. We found that the Cook framework really fit well with our data. All the 6 principles were relevant. So I've used those to organise our analysis, and I'm going to run through the 6 of those now. Next slide, please. So in terms of the first principle, developing skills and confidence, we had lots of data on this. So a whole range of development was undertaken. So firstly, in terms of the formal learning, so trainees had the core programme, and then also many of them selected master's modules, which they could choose, so they could tailor the programme to suit their needs. In the second key element was supervision. So trainees were matched with experienced researchers who could offer one-on-one support, support either one-to-one or in small groups, and also opportunities to get hands-on with research projects. In terms of applying knowledge in practice, so trainees often were able to take and cascade learning back within their teams in organisations, supporting other people to get involved in research or organising training for colleagues. And then, as well as these more structured learning or application of research techniques, the programme really offered a chance to experience academic culture and environment as a whole. And even for some, even though for some this was actually a bit of a culture shock, even people who had quite senior roles and who had a lot of clinical experience admitted they were quite thrown at first by some of the academic language and terminology, and it was quite new to them. But over time, what people really wanted was an experience of how research really works, and they were able to gain that. And the last bullet point here, the time and space, again, aside from the more formal, kind of formal learning opportunities, the programme provided people essentially with headspace and time to think critically about research. So one of the trainees described it as having reset her mind, and supervisors really perceived this. And when they could see someone's sort of mindset shifting, that was a key aspect of satisfaction about the supervisory role. And as one of them put it, she said, if somebody starts to think differently or look at papers more critically, then they'd feel not that their work is done, but that the programme is working. And they actually said, sort of really focusing on the individual level. So if that trainee came in and had that shift of mindset, even if they didn't continue all the way through an academic career pathway, that for them, the programme, that impact on the individual made the programme a success. And in terms of main limitations around this principle, although trainees were positive about that kind of transfer of the skills and sharing them with their teams in practice, the managers that we spoke to had less to say about this, and this raises questions about how convinced managers in organisations are about benefits beyond the individual trainee. And the other limitation that we found was that some of the supervisors felt that their contribution to supervision work wasn't actually always fully recognised. Next slide, please. So the second principle, close to practice, trainees tended to enter the programme with research interests that had been sparked in their own area of practice. So there were already, ideas that were close to their practice, and some had already started to think critically or critique the evidence base where they worked. So, for example, one worked in a service that had won several awards, but she pointed out there was no actual robust evidence for that, and she came into the programme to undertake a service evaluation to generate that kind of evidence. Another trainee who was a physiotherapist undertook some evidence appraisal and was then able to, from that, started using a new type of assessment, which they were able to introduce in multidisciplinary team meetings and influence clinical decision making. So the final bullet point here is referring to an issue that was less positive and fairly complex. So that was the visibility in research activity and leadership between professional groups or clinical areas, and sometimes even within the same trust. So, there were several interviewees were based at a large teaching trust that does have a lot of research activity. However, what we found from the interviews was that they described a contrast between, on one hand, working in a multidisciplinary team, which might be quite research active, but the team itself would be probably led by a medic, and obviously none of our trainees were medics. And there were experiences there where, although allied health professionals might have contributed to research in a team like that, they probably wouldn't be leading it. And they contrasted this with experience within what interviewees call therapy teams. So, for example, physiotherapists or occupational therapists, any allied health professional working in an AHP-led team, where there may be less of a research culture. So if they may have more chance to be leading research that's close to their practice, but what was termed clinical managers within those teams may have less experience or understanding of research, and this sometimes leads to people really struggling to have managers either protect or sign off backfilled or protected time. Next slide, please. So the third principle, in terms of linkages and collaborations, so our trainees found the programme great for networking. They appreciated getting to know supervisors who often introduced them to others within the university. Those who, some people went on from the internship into the pre-doc, and they obviously built up a supervisory team. The supervisors all said they enjoyed meeting and getting to know their interns and their pre-docs, learning about them and their work. The supervisors working at professorial level tended to think that the programme helped build links with the system, but there was less perception of that benefit from the supervisors working at mid-level. Next slide, please. So this fourth principle of dissemination, essentially, I'm sure you're all familiar with the types of output on the bullet points, so I'm not going to expand on these too much. So just to say there was lots of activity, trainees produced outputs in all of these formats. Something that's not on here that I was going to mention is there's an annual showcase for the programme where each trainee produces a poster, and they also give a presentation, and it's open to everyone involved in the programme, and it's also open to managers within the local system. And one of the trainees actually commented that it was the point at which her manager, I think she actually came along to the showcase and saw the poster that she'd done that summarised what she'd done, and aside from these types of dissemination, that was where it seemed to really hit home to her manager how much she'd done on the internship and how much she'd achieved. And one of the managers that I interviewed similarly said that her intern had brought her the draft of the poster she was doing, and it was really at that point that she realised the impact. So I think this raises questions around how much these outputs are then going on to feed into the system and influence practice there. Next slide, please. So in terms of continuity, following on from dissemination, one of the main forms of continuity was ongoing collaborations where people were co-authoring outputs with art researchers even when the programme had ended. And there were examples of people securing grants either for dissemination or to continue their research. So the intern and pre-doc programme is kind of, it sits at the earlier stages of a pathway that would traditionally lead from lead on into a pre-doc, a PhD fellowship, a postdoc and an academic career. But there were quite a few comments about people following, about how that traditional trajectory may not be for everyone, and which kind of raises questions really about how research capacity can be sustained in other ways or through different opportunities. Next slide, please. And finally, in terms of infrastructure, so this is back to back to some of the structure of the actual ARC programme. So trainees and supervisors really appreciated the programme structure and the way it was organised, including the capacity building core team themselves. They found them very approachable and responsive, which really helped. They appreciated things like the regular catch-ups. There were a few comments around minor adjustments that could possibly be made. So things like having the catch-ups in person as opposed to everything having been online for the last few years. In terms of how people find out about the opportunities, a lot of trainees have tended to sort of find them themselves through reading bulletins. And so there were a few comments around the potential for example, R&D departments in organisations possibly doing more to promote opportunities. And again, with the challenge that some faced in protecting time and backfilling roles, there were suggestions that R&D departments could possibly do more to support around that. But again, that started to become sort of subject matter that was going beyond, beyond the content of the ARC opportunities. Next slide, please. So just to summarise before I finish, so the programme overall provides a really wide training of skills, both formal structured training and the sort of wider experience of academia. And there are examples of people being able to do research that was close to their own practice. The key challenges seem to be around, for some people, protecting time and their having roles backfilled. There was some variation in research culture, and there may be a need for greater recognition of benefits beyond the individual and the impact further into the system. Thank you. So I think that's all the slides I've got. I did just want to, in terms of thanks, this was an internally funded piece of work, so wanted to thank the ARC for funding it and also to thank everyone who took part in the interviews. And in terms of our dissemination, so this is the first presentation of this work. It's been accepted for a poster at the HSR UK conference, and I'm currently writing it up for submission, which is, I think that's going to be the Health Research Policy and Systems Journal.
Great. Thanks, Beck. That was really good to hear that. And we have time now. We have lots of time for questions, comments, feedback. And can I just also say thank you to everyone who has supported us in delivering these programmes, because we know people put a lot of time into supervising and providing opportunities, having conversations, networking. And as you can see from Beck's slides, that this, we're having impacts out there for these individuals, and hopefully that will spread as time goes on. Caroline, have you got a question?
Actually, I was just turning my camera on. But,
oh, sorry.
But I will. I just thought you might want to see a few faces. But anyway, I actually was thinking of asking something. One of the things it was really good, very interesting to hear about that. Thanks so much for your presentation. Yes, one of the things I was interested in, of course, relative to that really large number of participants, relatively few have at the moment on the gone on to do PhD or waiting to hear, because I think you mentioned 5 who are either doing PhD or waiting for PhD. And then I was interested, Beck, that you said, that many have noted the sort of that sort of traditional pathway may not be the right pathway for everybody. So I wondered, do you have a sense of where other members of that cohort are up to in terms of their next steps and what they're planning next? And also, did you get any insights in terms of what they would envisage as being a better pathway, or what might need to change more at that sort of strategic level about supporting people to have combined careers, perhaps in their practice roles alongside developing an academic career? So yeah, just your reflections on that. Thank you.
Beck, did you want to come back on that at all? From the evaluation point, obviously we can speak more widely in terms of the whole cohort.
Yeah.
What was it?
Yeah, can do. Thanks, Caroline. So I think, I won't try and I haven't got sort of specific numbers on how many. So at the point that I did the interviews, a few, that's as far as I'll go with numbers. So some of the pre-docs had made applications for PhD funding, and then unfortunately at the time that I was interviewing them, I spoke to 2 or 3 who'd been unsuccessful, but I think some more have since secured PhD funding. So some of the issues that came up, some were around timing, and things that you might be familiar with, and things that already exist, like bridging schemes. So some, again, it was even people who, not just people who didn't have any research experience, it was kind of across the board, people saying that to go straight from one opportunity to the other could be too intense or too quick. So for example, they might need to do one opportunity, and basically the issue of headspace came up again, time to think, or time to apply, and people might need bridging. And then we did speak to a couple of people who have more strategic roles supporting these kind of programs across trusts, and they acknowledge the need for more navigation. And obviously probably challenges that people are well aware of, that there's not, there's limitations on resource for that. And that's sort of, it's quite hard. So it's quite hard to put out sort of patterns and make recommendations on it. And again, as I said, because we went into the detail of what this programme provides, and it sort of signalled some of those wider areas that are maybe systemic. So I feel like I've kind of raised those questions and don't have very strong answers for them, but those are the kind of things that people brought up. Sorry, and there was actually somebody brought up, for example, so this program's obviously, as we traditionally was for registered health professionals, and now it's open to people with a degree, but people raised, for example, issues around backfill, when people, the lower down, if backfilled roles are often filled by someone in a lower grade stepping up, for example. So we got insight into how that's a challenge for managers. But then in terms of things like schemes for people working at lower grades who might not be qualified, so those kind of things were raised as well. So yeah, does that partly answer what you're asking?
And I think we don't have numbers on how many people have applied. Some people were unsuccessful. They're extremely competitive. And I think the NIHR realised this, and hence why we've had that pot of funding for pre-application support. So that's kind of like a bridging fund to give that time, allow that time to pull that application together, really. And people have taken different journeys. And I think also we were impacted by COVID, being from the healthcare setting, that was all going on as well. So that has had impacts on people's careers and where they've ended up. And we're seeing now people come to us with ideas that they've kind of had to put to one side over the past few years. So I think we will watch this space with this. Thank you. Pete, you got your hand up?
Yeah, thanks for that. I suppose it was interesting, that broader impact beyond the individual. So NIHR's had a big play that doing research is good for organisations. And is that apparent in either the people who've been through the scheme or their managers or their supervisors, the idea that this is good for at an organisational level as opposed to an individual level. Did you have anything on that? You talked a little bit about the broader impact.
Yeah, I can try and answer that, Penny. So a little bit. So one limitation is that we had a small number of managers who we spoke to. So they were quite honest in terms of saying they could see the benefit for the individual, and they were well intentioned, so they wanted to support the individual to develop whatever they wanted to develop in their careers, but they were honest in terms of saying, has there been a direct benefit to the team? No. But again, they would say the response was no, but there could be in the future. But did seem often to be seemed to be balanced against the real challenge of the impact of taking, backfilling, or however the person comes out of their role, of kind of trying to just manage those challenges. There was quite a lot to weigh up.
That's great, thanks.
And I think there's definitely a message at the higher levels of kind of the organisation. This is a good thing to do, but it's that middle management who are dealt with the real pressures of clinical care delivery. So I think that's where they get caught in the middle. But hopefully, over time, we'll see that these people will be those future leaders and these managers, and that they have that understanding, especially of our research systems and all that goes with it. So yeah, it's a work in progress. Thanks. Kate.
Hi, I don't know many of you, but I'm a nurse at Christie's, and I completed my PhD last January, and it was really interesting, and a lot of what you were saying, Rebecca, resonated with the feeling. I think at Christie's we've got a group of aspiring researchers. We're trying to increase that capacity, and all the reasons that you gave are what people say to us. And from the organisation point of view, I think we are supported, but a clinical academic career is a little bit more uncertain than a traditional clinical career, and the people are often weighing up, do I go down a research route or an ACP route where they're guaranteed promotion, they're guaranteed a role at the end, a secure contract, and coming from the NHS, where we're often on permanent contracts, to come into the academic world where contracts are very different. I think that's a big barrier to people taking that leap into doing research. We're still forging those pathways, and I don't think it's clear yet in the hospitals how we're necessarily combining the two. So yeah, it's we find the same thing with people who are wanting to take the next step, and then they're really competitive. So I think as well, probably my last comment is trying to increase that awareness and that respect for research, even if people aren't doing it, but just have an appreciation of being able to critique and evaluate and use research to deliver services isn't always there, and is definitely needed, and that would help support and help people realise the importance of supporting people to do more research. Yeah, thank you.
Thanks, Kate. Thanks for sharing that. That's really interesting to hear.
That's useful. Thank you.
Yeah, and I think the NIHR again are aware of that in terms of where do people go next, and there is a risk that there aren't, while you're doing the research, that you haven't got that position to go back to in your clinical role. So there needs to be more going on in that kind of area. Thank you, Kate. Neil, you got your hand up?
Yeah. So thanks. Just for the people in the room, I'm Neil Bendel. I'm a public health specialist working in Manchester City Council, and I'm currently just started on my pre-doc, so I'm in the scheme at the moment. And I guess I'm interested in, well, I guess a couple of things really, but One is whether as part of the research you looked at people's entry into the scheme and kind of what their drivers were, but also I suppose how they found out about it, what the communication routes were, those types of things, and whether that then gives you any lessons for future targeting of people to go through the scheme, thinking particularly of those who are not from a non-clinical background like myself, or who are not from something like a teaching hospital where research is fairly well ingrained into the warp and weft of people's of the organisation which they work. So that's kind of the main question really, and I guess related to that, again, I don't think you've probably got very much in your sample of people, but in terms of whether there are any specific issues or specific lessons that kind of came out specifically for local government in the context of the NIHR's health determinants research collaborations, HDRCs, which are all about building research culture, part of which is about training and development of staff to be, through schemes like this to build up their capacity such that there's more of a research capacity within local authorities. So a couple of related questions, but I think the first one probably the most interesting in terms of routes into it, I suppose. How did they find out about it, what their drivers were and things like that?
Yeah, sure, thank you. No, great question. So to respond to the first one, so a real range of kind of motivations and where people were at, so ranging from some people obviously coming to the internship rather than the pre-doc with no experience of research, and they really wanted that a taster of academic life. And that's, I think, when I was talking about the value that goes beyond the formal elements, so that kind of wanting a taster or dipping their toe in. And then if we can say there's a spectrum, so people at the other end maybe going straight into the pre-doc, very focused on actually following that more traditional trajectory, and knowing that they want to pursue a clinical or practitioner academic career, maybe even have had some experience of academia themselves, and basically everyone else in between, if that makes sense. In terms of how they found out about it, a lot of people, there was quite a few people saying they'd almost stumbled across it essentially from reading bulletins, so trust newsletters and that kind of thing. So two main groups, I guess, people who found it themselves, and then people who've been signposted in. And it might be people who already had some contacts within academia, someone who then became their supervisor might have said, oh, you should apply to this opportunity. And some, I think some were actually from people who've previously been on the programme, and the people that are out there signposting opportunities to other colleagues. So a mixture. And just your final, the one about local government, I don't have much to say. In the sample, I think I'm right in saying participants, I had one person, no, two, there were two people based in local authorities. I remember the person saying there is no research in X council, and they were one of the people who hadn't, there was variation in how much support people had in terms of getting their time approved, and some people had quite a difficult time and been refused and really and pushed back, or found a different route in. So I'd say it's challenging, and I'm afraid I'd probably put it back to you and say it's something we need to learn about. So most of the sample and most of our understanding is based on NHS organisations. So it's obviously a big question and a gap there, understanding how this works in local authorities and what needs to be done.
Yeah, I think we might be coming to you, Neil, for some advice about how best to approach this in the future. Thanks, Neil. Sue?
That's really interesting. I was wondering whether you got a sense of, because obviously the relationship between the supervisors and the students has been really strong, and the link back to practice. Do you get a sense of how well we've done or not in terms of accessing, and the peer support I think has been really helpful as well, but that bigger access to the ARC team, because I think the value of doing an ARC internship versus something that sits very separate without that infrastructure is the networks that we create within ARC and the opportunities we create. So obviously from a public environment engagement point of view, we have provided opportunities, but I think there's a lot more we could do to systematically say you are part of ARC, therefore you have the whole sort of gamut of people within ARC to learn from, and you know, making sure people are well signposted to the expertise within the team. So I'm just wondering whether you got a sense of that, and also whether there's more we could do to make that more formal, I suppose, so that everybody's getting access to the same opportunities.
Yeah, thanks, Sue. Two really good points, and I will say the probably things that I probably should have covered. So firstly, in terms of, can I do the PPI first, just to respond to that? So actually that was possibly a notable absence from my presentation. So it fits within the principle of being close to practice, and PPI basically is an element of that. If you look at Cook's framework, and there's lots of examples of trainees doing PPI and that fitting with research that's close to practice and you know, needs of organisations and service users. So there is, if I can pull out more of it, if it's useful to look at positive examples of interaction with the ARC PPI support, if that makes sense. In terms of networking across ARC, there's variation actually. So some supervisors did comment that most interaction that their trainee had would have been within their own theme. So, and it's related, there were different setups to supervision. So some of the supervision was more structured, and that actually matches with certain types of research that was being undertaken. So the evidence synthesis researchers, I won't go into all the detail here, but there's a very structured, developed program that interns actually follow, which has got massive strengths. But you could say that a downside of that is less exposure to the rest of the ARC, and then other supervisory relationships involved a less structured approach. But possibly a benefit of that was sort of meeting more people and networking more widely. So a real mixture. And now you've asked it, I feel I need to go back and have a look at that actually.
I think it's just making sure that we're maximising the opportunities to put something more structured in, and not that everybody would take it up, but that everybody is having the same access of opportunities to think, and it's not kind of highly dependent on individual ways of working. Yeah, no, really interesting. Thanks, Bex.
Yeah, and I think the program's evolved, so we've started to implement those core sessions, so everyone's getting that, has access to it if they can't attend on the day, and the skills audit, but then allowing for that bit of tailoring where it's needed, because they're all very, you know, people come from different experiences and backgrounds. So yeah, it's a fine balance, but I think we want to pull that out, don't we, about the benefits that particularly that you might get on a national scheme, on our scheme versus a national scheme, and that peer networking. I think that definitely came out. Oh, Amy's here. Amy.
Hey Penny, thank you. Something that just raised for me was something that related to my own experience as someone that was new to research, which was the etiquette when approaching peers, ARC members and supervisors, even potential supervisors. So I think kind of guidance on the etiquette for connecting and approaching and networking would be really useful for future members, because that's something that I was very fortunate to have guidance and support from a few existing ARC members on how to overcome that nervousness, confidence issue, and how best to approach potential supervisors and other ARC members. But for those that maybe don't have that existing relationship with ARC members and are brand new, that etiquette advice and guidance I think would be handy.
Yeah, that's a great idea, Amy. I think yeah, and I think because of COVID, we had very much sort of online. When we move into these face-to-face opportunities where we get everyone together to have more informal discussions. But a lot of people, like we do in academia generally, have imposter syndrome. But you can see, going from a outsider coming in, it's about what we can do to make that
that was absolutely
process.
Absolutely part of it.
Thank you, Amy. Any more questions? Can't see anything in the chat. I know that there's another seminar for some people coming up at 1 o'clock, so I won't keep people today. You might need a quick break. So just like to thank Beck for her great presentation and all the hard work she's done on our evaluation, and the rest of the team and everybody for their support in our capacity building efforts.